Hello, my name is Joseph Tremmel. I'm a physician assistant student and I will be presenting end-stage renal disease. First, just a little anatomy of the kidneys. The urinary system helps maintain homeostasis by regulating water balance and removing harmful substances from the blood. The blood is filtered by the two kidneys, which produces urine, which is a product of waste and other substances. So from each kidney, the urine flows to the tube or the ureter, to the urinary bladder, where it's stored until it is expelled from the body through another tube named the urethra. The renal cortex borders the convex side, and the renal medulla lies adjacent to the renal cortex. It consists of striated cone-shaped regions called renal pyramids or medullary pyramids. Those peaks that it makes are called the renal papillae, and that are facing inward. And this combines into the calyceal system, the minor of each of the pyramids, into major calyx, and then into the renal pelvis, and then into the ureter. The kidneys are located in the retroperitoneal cavity, and the left kidney sits a little bit higher up than the right one. So the actual removal of waste occurs in tiny units inside the kidneys called the nephrons, and each kidney has about 1 million nephrons. In the nephron, a glomerulus, which is a tiny blood vessel or capillary, intertwines with tiny urine collecting tubes called the tubules, and the glomerulus acts as a filtering unit to keep normal proteins and cells in the bloodstream, allowing extra fluid and waste to pass through. At first, the tubules receive a combination of waste materials and chemicals that the body can still use, so the kidneys measure out these chemicals like sodium, phosphorus, potassium, and then release them back into the blood to return to the body. So it regulates the body's level of these substances. End-stage renal disease is the total or nearly total permanent kidney failure. It's also called. So if a person's kidney stops working completely, the body fills with extra water and waste products, and you get a condition known as uremia of the blood. Ultimately, this uremia may lead to seizure and coma and possibly death. So a person whose kidneys stop working completely will need to undergo dialysis or a kidney transplant. We'll discuss this later. Some of the major causes of end-stage renal disease would be kidney disease, which end-stage starts as early kidney disease, very commonly diabetic nephropathy, chronic kidney failure, hypertension, glomerular nephritis, polycystic kidney disease. Because a person can have a kidney disease without any symptoms, a doctor first may detect the condition through routine urine blood tests. And more specifically, these three simple tests are albumin in the urine, the GFR, and the creatinine measurement. They can also do some kidney imaging, such as CTs, sonography, or a kidney biopsy. So what can be done about end-stage renal disease? If it's severe enough, the person may need to undergo dialysis or transplant, as we spoke about. A person can function with one properly functioning kidney. However, if both of them are severely compromised, then they may need to have some more serious treatment. So dialysis is removing the waste substances and fluid from the blood that the kidneys normally do. So two types would be peritoneal dialysis and hemodialysis. So peritoneal dialysis is placing a surgical hollow tube into the lower abdomen, and the tube is placed, and then a solution called dialysate is instilled into the peritoneal cavity, which absorbs the products and toxins, and then that fluid is drained, measured, and discarded. Hemodialysis can be performed several times a week, lasting 4 to 5 hours, and that's the mechanical filtration of the blood. The other option would be transplantation. So the kidney transplant is the replacement of a non-working kidney with a healthy person's kidney or a donor. So as we said before, you can normally function with a kidney as long as it functions properly. And the way they do that is they place the donor kidney into the abdomen. They connect all the blood vessels as well as the ureter, and then they leave the two kidneys in place as long as there's no infection or other problem that they're causing. So thank you for your time and consideration. Some more information can be found on the following sites, ranging from the National Kidney Foundation to the American Association of Kidney Patients. So thank you for your time.